Welcome to this edition of Healthy Living. I'm your host, Tim Kelly. We're joined today by Dr. Nancy Welch, who is the interim director of the Tidewater Health District, to talk, unfortunately, about flu season. We already covered it once, Dr. Welch, but we're here to talk about it again. Why? Because it's been a very busy season, and we're not done yet, correct?
Oh, it's just beginning, and it's coming with a vengeance.
Kind of tell us about where things are at this stage of the game. I mean,
Right.
I know every season's a little bit different,
Right.
and certainly we've all been reading about it and seeing it, that it has been very prevalent this year.
Let's put it in perspective. This is the earliest we have begun such a high flu season in 10 years. And it is with the H3 flu. Now, some people may remember the H1N1, where we did the vaccinations in the schools. That form of flu was much milder. The H3 comes in with a vengeance. It is a much harsher flu virus, and so it portends that we're going to be in for a harsh season. Now, when we start so early, there are generally, although I'd love to be proven wrong, there are generally two ways that historically it goes. You either peak, and we are at a definite peak now, that started in December. You either peak, you come down, have a little hiatus, and go up again for a second peak in, say, March or April, or you stay up the whole flu season. Now, I would love to be proven wrong and have a new trend, so we peak, it comes down, and it stays down.
That's right, that's right. But we have to still, time will kind of bear that out, I assume. Now, I know when we talked originally, we talked about the flu vaccine, or getting inoculated at that point in time. Is it too late, being that, you know, again, all these cases are rampant, you have people all over the place that are encountering different symptoms of it. Is it too late to still get that vaccine?
No, it's absolutely not too late.
Okay.
But I need to inform people about some things, because the flu vaccine is about 60 to 65% effective. Now, if you go into Las Vegas, you would certainly still buy 60 to 65% over zero.
That's right.
Because if you don't have the flu vaccine, then there's zero effectiveness in terms of preventing you from getting the flu if you're exposed. So I've had it, my kids have had it, I still go with the 60 to 65% effective. Now, in taking the flu shot, it's absolutely not too late to take it. We're still encouraging people to take it. But again, we have to have a little caveat here. It takes 2 weeks for your body to develop your antibody protection. So during that 2-week period, if you have already been exposed, if you already have that flu virus in your system, then you're not going to prevent yourself from getting that flu. You will perhaps, and very likely, make the symptoms less than it would have been if you had not had the flu vaccine. But it takes 2 weeks to build up your protection. Now, a lot of people will misinterpret that to say, oh, I got the flu shot, it gave me the flu vaccine. Absolutely impossible, because the vaccine is killed. It's dead. It's not alive. It's incapable of causing the disease itself. But it does take that 2 weeks to develop protection. So if you already have been exposed and it's already in your system, it's not going to stop that for 2 weeks, but it certainly can make the symptoms less.
That's right. And of course, that can be a big difference when you're talking about dealing with the consequences of coming down with the flu. So, now, let's talk about just the basics of the flu. What if, you know, people think, well, do I have this? Do I have that? I mean, what are some good telltale signs that, look, you probably have the flu or are heading in that direction, you need to go seek medical attention?
Very good. When we monitor and we do surveillance, and you've seen this all in all the information you receive, ILI, influenza-like illness, and that monitoring relates to generally the symptoms of high fever, of muscle ache, of respiratory symptoms, of just severe, you're laid out. You really just want to stay home. You don't have much energy at all. You're really quite sick, loss of appetite. That's influenza-like illness. Now, I will say at the beginning of the season, we had a little blip in an influenza-like illness that was a little milder, caused by a rhinovirus, which we usually associate with the cold, but this particular type caused a little bit more symptoms. So it was picked up on our radar screen with the influenza-like illness. But flu itself, you have much higher fever, and you really are, you want to go to bed.
So if you find yourself with that situation, what are some things that you probably need to do sooner rather than later? Do you need to go to your medical, seek attention? And if so, what kind of things can you expect, maybe possibly? Again, we're not diagnosing folks here, but more just sort of a general concept here.
Well, first off, with regards to going to your physicians, I would say some physicians vary on that, because obviously they want to protect their other patients who are in their waiting room. So generally physicians might want you to call their office first, because they might want to be able to speak with you, diagnose over the phone, determine, for example, if you're in a high-risk population, if you have chronic disease, if you have asthma, if you're elderly, if you have pulmonary disease, cardiac disease, then that puts you at a higher risk of complications. So they indeed might want to see you, but they might want to know exactly when you're coming and be able to bring you right back to a waiting room, I mean to an exam room, so you won't be sitting in the waiting room and exposing other people. Or they may want to emphasize, as many doctors' offices are doing, we have masks at the front, come up to the front desk, get a mask, so we're not spreading it. So call your doctor's office first rather than necessarily just show up, because many of them do have sort of protocols that they want to follow. And it is true that there is a medication, if you take within the first 48 hours, can very often reduce the symptoms by perhaps 2 days. That's generally what that information has shown. But beyond that, probably one of the bigger kinds of complications and concern people get is dehydration, because they feel so badly, they don't want to eat, they don't want to do anything. Well, you can go without food, but the key is that liquid. You know, just even if it's small amounts more often than large amounts, but taking fluids. And it's always good to have somebody know, if you're living by yourself, to have somebody check on you. And obviously, if you're at home, to have your family check on you and sort of be sure you're getting the fluids. And in a family situation, because it spreads so easily, you really want to use a mask. You can get masks many places, just you don't need a prescription. And have lots and lots, emphasize hand sanitation, emphasize washing your hands often. I have hand sanitizer in my car, my purse, my office. Emphasize the use of hand sanitizer at all times. And emphasize, you know, when we were growing up, I'm older than you, so maybe that's not true for you. Our parents would say use a tissue. Well, you'd use the same tissue over and over, and that would mean you'd have germs on your hands. So then if I shook your hand, I touched this, I'm spreading the germs. So actually a more recommended mode is when you cough or sneeze to do what we call sort of the elbow or shelbow, shoulder, shelbow. I just coined a new word.
There you go, all right.
Where'd that come from? But interestingly enough, the children are catching on to this much more rapidly than adults, because we still carry around that tissue. But it's good, because if you don't block that cough or sneeze, that virus can go out 6 feet. So this is a very simple thing that keeps it confined and keeps it from spreading. So those kinds of basic common sense things. And if you're working, stay home. Stay home. So many people are guarding their sick leave because they don't know when they really need it. Well, this is one time when you really need it, not just for you, so you can stay home and heal, because when you're working, your body can't devote its calories and energy to healing. But you also run the risk that you're going to be spreading it to other people in the workplace. So you want to be considerate of them as well. And we're certainly encouraging business owners to be sure that they let these people stay home.
Because as you mentioned, you know, again, it's not just the individual, but you could possibly spread it to your fellow employees or your customers or whatever, and then you're keeping this cycle going where it's, again, getting out in the community and people are being exposed to it. What are some good things to think about, that if you're in an office or a company environment, and you know there's some people that have chosen to come to work and they're in that situation, what can you do to maybe help yourself in that confined space or that limited space? What are some general tips that maybe someone might want to consider?
Well, of course, if you happen to have a relationship, a friendship, a conversational relationship with that individual, I think it's important to express concern for their health. People are going to be first and foremost concerned about their own individual health. To express concern about their own health, and that they really probably can heal faster and feel better and really get back to their normal state sooner if they do stay home and let their body heal. Your body has healing mechanisms, but they have to be able to devote the energy to that healing, as opposed to being at work and also devoting energy to doing all the things at work.
Sure.
So I think that having compassion for that individual is first and foremost. And then, of course, it also is important to share. We'd like to be able to keep it from spreading. So beyond that, then the same things I've mentioned in terms of hand sanitation.
Right.
Be sure that individual has hand sanitation,
sure.
so that they're using it on their hands very often. If they are sharing computers or keyboards, you want to be sure and clean the keyboards.
Right.
And you can have just those Lysol wipes kind of thing, and you can wipe phones and door handles if they're shared, so that you don't do that. And a simple little thing, I know our common way of introducing is to shake hands.
Sure.
You know, you and I did that. It's just sort of comes natural.
Correct.
But then people should not be insulted if subsequently you use hand sanitizer.
That's right.
That's just a way of still being cordial, but
Right.
also being protective at the same time.
Anything, again, you're in that environment that you can do for yourself. I mean, do you want to possibly bring a mask and maybe have one around? Would that be beneficial to you, or is it more so for the person?
It's more so for the person
Yeah.
who has the symptoms,
Okay.
because they're the one who can spread it out.
Sure.
So it's really, the mask is of most importance for the individual who has the symptoms. Now, if they can sit at a desk and there's kind of a 6-foot perimeter around them, it's not as much of a concern.
Okay.
But certainly if they have shared things, shared
Right.
phone, or
Right.
like I say, keyboard or something like that, or shared door handles,
Sure.
many in the same door, then you want to just wipe those off.
Okay.
And again, other people in the same environment to have their hand sanitizer and cleaner. Because you don't realize how many times during the day you maybe bite your nails, or you share pens or pencils and then you put it in your mouth. It's just kind of absent-mindedly do
That's
these
right.
things. So that's why just frequently doing the washing hands or hand sanitizer.
Okay. Now, when does flu season typically end? And I use the word typical. And again, is there a range? I know there's sort of a, maybe not, you know, like hurricane season, we can have a
Right.
start and an end, but it can happen outside of that.
Right.
And I think the same thing certainly would apply here as well, correct?
Oh, yes. Generally, we get through May, we're done with it.
Okay.
But we have been known to have peaks in April,
Mm-hmm.
as well as December and January kind of thing. But so generally, the end of April and May, we're going to be content to get through those seasons. But a lot depends on, especially since we started so early
Right.
this year,
Right.
a lot's going to depend on whether or not we're going to be a 2-peak season or stay up for a while and then come down. Generally, if it's going to be a 2-peak season, the season will last longer simply because that second peak
That's right.
has a break in between. But
Right.
if it stays up the whole time, then generally it's going to come down sooner.
Okay. Well, I think we're about ready to wrap it up, but Dr. Welch, I'll leave you with one last question here. Anything, again, just to kind of recap, anything we've talked about that you'd like to really get a message out there to tell people, hey, this is what's going on, or this is what you need to do? Just any parting words?
Well, I think probably, again, back to the flu shot. People may remember years ago, we used to just emphasize the flu shot for people who were high risk. And that's because our thinking at that time was to prevent complications, because those people are the ones who would end up in the hospital or worse. But our strategies have changed dramatically. Our whole focus now is to actually prevent the availability of that virus within the community, to prevent the disease itself, because that's the most effective way of preventing complications, by preventing them from being exposed to the germ. So we are emphasizing the vaccine, and it has tremendous value from 6 months on up.
Right.
It's not just for those who are high risk, because many people don't get really sick, but they spread it.
Yep. So it kind of, you want to not just prevent it for yourself, but also not end up being a carrier, so to speak.
And spread it.
That's correct.
Right.
Okay. Well, Dr. Welch, thank you again for taking the time
Thank
to
you.
be with us today on Healthy Living. And again, as we leave you, we'll say, to your health.